Okay, if you are on the fence and you're like, I don't know if I want to have kids or not, you should definitely think about that before you have them. Duh. But I wanted to talk about why fertility is important, even if you're kind of in that boat of like, I don't know if that's going to be for me or not, right? Like, fair. These kids are a lot of work, but they're lovely. I just want you to kind of be mindful about this because I knew that I wanted kids eventually, but I didn't know like when. And then when I was ready, I was like, I'm ready right now. I want to get pregnant like right now. And then it didn't happen. And I was like, this is not what I was anticipating. So here's kind of what to be thinking about, especially if you're kind of in this same boat, or if you are maybe like, know that you want to eventually, but you're like, I don't know, it's not right now, right? So like, who cares? I so identify with you. Okay. So, your fertility still matters even if you're not sure if you want to get pregnant, because your fertility is also kind of a sign of what else is going on in your body. And when I have clients, sometimes I do have clients who are like, we don't really know if this is for us or not. Great. That's fine. Let's work through that. But also let's be thinking about longevity and what else may be going on, because when I'm working with clients, they're like, oh my God, I just feel so much better. Oh my God, my bloating is better. Like, we figure out like what is going on with your body, and that's improving your overall health, and it's also improving fertility depending on what you decide you want to do. Okay. So let's start thinking about why and when. So sometimes people are like, I don't know if I want to have kids yet because you're career focused. You have like certain goals or educational goals or career goals that you want to meet, or any kind of goal. Okay. Again, may not be sure if you want to have kids or not. You have not met the right partner yet. And you're like, this is not, I don't want to have kids with this person. Great. May want to think about egg freezing. And egg freezing can provide you some options later. So say you're older or you have a history of some issues that may be pertinent to fertility, and you're like, I should probably preserve some eggs. I think that's a great option for a lot of people. I don't think everybody needs to do it, but I think it can be a really great option, especially if you have benefits that provide assistance for egg freezing. It's a pain to go through, but the rewards can be really great. So the rewards are, if you do struggle with fertility, even if it's not like your first kid, maybe you want to have multiple children and you get pregnant really quickly with the first one, great, love that for you. But if we have some issues with like secondary infertility, so you're not getting pregnant after the first baby comes, now you've got those eggs that are years old, and they are going to be kind of preserved at the age that you freeze them. So if you freeze your eggs at 32, your eggs are going to stay 32. If you don't use them until you're 40, you still have those 32-year-old eggs that now you can use and implant into your 40-year-old body. Pretty cool, huh? So I think that that's a great option. But I want you to kind of be thinking about this and preparing, right? So again, if you're going to spend the time and the money and the emotional exhaustion and physical exhaustion of going through egg freezing, like, put some effort into it. Like, try at the beginning, like plan accordingly, and improve egg quality 3 to 4 months before you go through that process so that you get better outcomes. Because it's really disappointing if you're 40 and you want to use those eggs and they're poor quality because you're like partying all the time and not taking care of your little eggs. Go back to that after you freeze your eggs. Okay. Set up 3 to 4 months where you're just like really health focused and all into wellness. Your eggs will thank you, and then go back to your party girl self. Okay. I'm here for you. Anyways, so your period, if you're skipping your period because of birth control, I get it. Me too. I do that as well. But the problem is that it can mask a lot of things. This is basically just like not a podcast, but a video to my younger self. So your period is basically a report card saying like, okay, are we ovulating? Are we consistent? Do we have some hormonal issues? Am I spotting? Like, your period's going to give you some signs that something could be going on. Okay. So you want to pay attention to it, and you want to track it probably too, just to kind of keep up with it, be able to predict it. And that's going to give us some good information. If you've got really regular cycles, and by regular cycles, I mean that with a 1 to 2 day accuracy, you could push your finger on a calendar and say, this is when my period's going to show up, and 1 or 2 days before or 1 or 2 days after it's going to come. Okay. So if you can't do that, or your cycles are really irregular, that may be indication that it could be harder for you to get pregnant, because you may not be ovulating, or you may not know when you're ovulating, and we might need to kind of hone in on that. Okay. The other thing is hormone signaling. So if we're having, a shorter luteal phase, if we are having spotting in between your cycles, if we are having a lot of pain with cycles, like all this stuff is indicative that, again, something else may be going on. And if you think you may want to have kids in the future, this is just kind of a sign of like, that's a little atypical. We might need to work this up a little bit more. Or again, this may make it a little bit harder for me to get pregnant when I want to one day. Okay. Inflammation can cause impacts on egg and sperm quality and impact your cycle. And so can your metabolic health. So people with PCOS, insulin resistance, a lot of times we're having other issues that can impact fertility. But again, you may not know that you have some of these things if you've been on birth control or different medications that mask those symptoms for a long period of time. And that's okay, right? Like you're controlling a symptom. I am not against most of the time medication for people controlling these symptoms, right? Like you want that. But if you think like, I kind of want to do like a little check-in on myself, especially if you're not sexually active and like risking getting pregnant while you discontinue your birth control, it can give you some information if you're just like kind of want to do a fertility reset or check-in with yourself. Okay, so these are just things to think about, okay? Or if you're like, I want to have kids, but not for like a year from now, maybe think about checking in with these things. So in a year from now, when you're like, okay, I'm ready to have a kid, you're not just being like, whoa, my cycle is normal. Whoa, I'm not getting one. Whoa, what's going on with this? You're like, okay, I checked in with myself a year ago, and now I know like what's going on. Just so that you can kind of get to the reason and get to the repair faster. Okay. Birth control. Again, if you have not been on birth control and your cycle's really regular, we kind of know that's a good sign. Okay. But if you've been on birth control for a long time, which I love birth control, great tool. If you don't want to have a baby, use birth control. Okay. But it suppresses certain signals, and it can also deplete your body of certain like nutrients and minerals that are important for egg quality. So, you just want to be thinking about like, how long have I been on it? When do I reasonably think I may want to have kids? Do I need to plan to have this like IUD removed or an Explanon removed? Just for your timing, or like, when's it going to expire? Like, when does it need to be removed so that you can kind of plan accordingly? To maybe do a little experiment. So maybe if you've had something for a long time, you remove it, you kind of want to see where things are. Of course, use secondary contraceptive, aka condoms, to prevent pregnancy. Okay. Okay. So when coming off birth control, I usually tell people come off of it. If you're younger and you've always had really regular cycles, maybe like 3 months before trying to get pregnant, just to kind of get back into the rhythm of things. If you are older, or you have a history of irregular cycles, or you have any history of sort of like issues around your period, you may want to come off closer to like 6 or 12 months before getting pregnant, to allow yourself time to figure out, again, a plan to repair any sort of issue. So if your cycle isn't returning within 3 months after discontinuation of birth control, it needs to be worked out. Okay? If your period has not come back 3 months after you have stopped your birth control, you need to have that worked out. Okay? So then we're finding that out now and not in a year from now. Okay? So that is important. So that's one thing. And this is, again, come off earlier so you can observe your cycles, see if there's anything going on. And then that way, if you are having trouble getting pregnant, we've already kind of like, we're ahead of the game. Okay. Okay. So what to observe after stopping your period? Again, are my cycles returning to normal? Am I ovulating? You could do a little test to see if you're ovulating. So yeah, these are some red flags though. Okay. So if you are thinking about getting pregnant, or you just want to like improve your fertility, what we want to make sure are that your cycles are pretty consistent. Anywhere between like 28 and 34, 35 days can be regular. Okay. But it should be around that many days every single time. If you are skipping periods, if you're having months where you're not ovulating, or months that you are not having a period, that may be a sign that it's going to be harder for you to get pregnant. Okay. So we want to work that up now, so that if and when you decide you want to have a kid, we have some more reasonable information. I think another aspect of this too is that, like, if you find out that something is wrong, or that you have like early onset menopause, or your cycles are like indicative that we have a bigger problem, that may help you hone in on like, do I want to have kids or do I not? If you're like, oh, now that I'm learning that it may be harder for me to have kids or I may not be able to have kids, that may be the sign that you need to be like, okay, I want to go this way. I don't want this to, I think I want to have kids. And now you can kind of work this up. And then the other side of things, if you're just like, oh, it looks like it may not happen for me. I've worked with people that way too. That's fine. Don't feel bad for that. Or don't feel bad if you decide that you do want kids, right? Like, just know thyself, listen. And that can be a sign too of like, my fertility is a little questionable. I want to do what I can to optimize it. And maybe you think about freezing your eggs because we have some of these signs. Or maybe you think about, removing the goalie a little bit sooner than you had anticipated, right? Like you can make a better decision if you know that you may have issues. Okay. And I think that that's important because a lot of times this is not discussed. This is one of my big talking points when I'm speaking to other healthcare providers is like, we need to be educating our patients when we make a diagnosis of diabetes, of PCOS, of endometriosis, of thyroid disorders, family history of clotting disorders. Like we need to know that may increase your risk of infertility or make it more difficult for you to get pregnant and stay pregnant. Okay. And we need to educate our patients on that because when you tell people that they have certain diagnoses, if they're not thinking about having a baby right then, that may not be big on their priority list of things to check out, right? So you may not ever think about that conversation again. So I wish that when I was told when I was like 20-ish, I don't even remember how old, oh, you probably have endometriosis. We can't diagnose this without a biopsy. I don't think you need a biopsy because I think that we can control your symptoms with medication. But nobody ever said, by the way, this may impact fertility. And that really wasn't taught to me in nurse practitioning school. So I want to be thoughtful about that for other colleagues who are healthcare providers. I want to be thinking about that as a patient side of things too. Like that should be a sign to you. Okay. Okay. So if we come off birth control or if you have a history of these things, pain with intercourse, really painful periods, severe PMS, acne or hair growth changes, difficulty gaining weight, difficulty losing weight or rapid weight gain, family history of early onset menopause, hair growth changes, hair where you don't want it or losing hair, thyroid issues, autoimmune issues, all of those can impact fertility in a pretty big way. Okay. So these are kind of diagnostic clues to help us figure out like something's going on and we need to pay attention to this. Okay. So, how to prepare before trying. So you're like, okay, I want to have a kid. What do I do? Prepare 3 to 6 months in advance. You want to start getting prepared. Okay. You want to start working on egg quality. You want to start working on sperm quality. You want to start making sure the ovulation is consistent. You want to reduce the need of like these rush decisions of like, I'm not pregnant yet. We got to do IVF, right? Like, oh my God, I'm 37. I'm still not pregnant. I want 17 kids. And like, what are we going to do? IVF. Slow down. Like, let's get a little preparation on the front end. Okay. Just like I always say, like if you are going to run a marathon, pregnancy is a marathon and sometimes infertility is too. Okay. So you're not going to just like show up in Boston with your tennis shoes and not have prepared. At least I hope not, or at least I would not because I hate running. But also most people are going to plan and prepare because you know why? They want good outcomes. They don't want to be pooping their pants on a marathon. They want to have trained their bowels for that, okay? You know what? They want their shoes to be the right shoes. You want your headphones to last for that period of time so that you are able to listen to your music. You're going to want some snacks. You're going to want hydration, okay? Same thing for your fertility journey, okay? You want to make sure egg quality is good. You want to make sure you're ovulating. You want to make sure your cycle is consistent. We want to be providing these eggs and sperm with what you need. And as somebody who has worked with patients who are, I was a pediatric nurse for 5.5 years and took care of patients who were these beautiful babies who you're like, how has this person had 7 children in the last 7 years and they are on meth or, you choose it, any sort of drugs. And you're like, how am I having a hard time getting pregnant when these people who completely abuse their bodies and their babies in utero are getting pregnant so quickly? And you're just like, what in the world is right. Okay. Like, this is just crazy. So learn your cycle pattern, learn your red flags, identify them, and then take care of them, because it can be another sign that something else is going on, or things that may negatively impact your care or your future or your fertility, etc. Give yourself a window, set a timeline. Okay. You know what? In March, I'm really going to start paying attention to my body. But until then, I'm not. Okay, that's fine. Set a goal though, of like, okay, I want to start thinking about getting pregnant at this period of time. So I'm going to start planning ahead, 3 to 6 months before that, and basing, do I need to think about coming off my birth control if you're on it? How do I improve egg and sperm quality? Yada, yada. Okay. So don't panic. This isn't supposed to be a panicky, like, freak out, like nobody's ever going to get pregnant. No. Okay. I just don't want you to get to the point where it's urgent and now you're stressed and you're maybe making more rash decisions about your treatment plan or your options before you've had like a proper time to like figure that out. Okay. So if you can plan ahead and you can get to understand your body and your fertility, you can address some of these issues earlier, which is a good thing. Okay. Cool. I hope that was helpful. If you have questions, comments, drop them below. If you're like, I need to prepare, what do I do? I have a course that is called Get Pregnant Faster, and it breaks down all of this stuff on how to prepare, how to avoid IVF, all those things. Okay. So if that is of interest to you, check it out, because it's got a lot of good info on how to kind of stagger some of that. All right. Anywho, have a great day. See you next time.